Have you ever wondered why some diseases like malaria and Leishmaniasis are so feared worldwide? These silent killers are more than just a cause of fever and discomfort. Globally, they're responsible for hundreds of thousands of deaths each year, striking indiscriminately, from the bustling cities to the most remote corners of the world. The gravity of their impact is immense, with an influence that extends far beyond the personal health sphere. To understand why these diseases are such a concern, we need to dive deeper into their symptoms. Identifying malaria and Leishmaniasis starts with recognizing their symptoms. Let's delve into the telltale signs of these diseases. Malaria typically begins with flu-like symptoms. You might experience a high fever, chills, headache, and nausea. These symptoms can appear between 7 days and 4 weeks after the initial mosquito bite, sometimes even up to a year later. Now let's turn our attention to Leishmaniasis. This disease presents differently, often beginning with skin sores that may become ulcers. Other symptoms may include fever, weight loss, and swelling of the spleen or liver. These symptoms can appear weeks to months after the sandfly bite that transmits the disease. Early detection is crucial for both diseases. It's important to seek medical attention if you have been in an area where these diseases are prevalent and you start to show any of these signs. Now that we know the symptoms, how do these diseases spread? Malaria and Leishmaniasis have one thing in common. They're both transmitted by tiny insects. Let's start with malaria. This disease is primarily spread by the female Anopheles mosquito. When this mosquito takes a blood meal from an infected person, it ingests the malaria parasites. Later, when the same mosquito bites another person, it transfers these parasites, sparking a new cycle of infection. Now, onto Leishmaniasis. This disease is spread by the bite of infected sandflies. Much like the mosquito, the sandfly becomes a carrier of the disease when it feeds on the blood of an infected person or animal. The parasites then multiply within the sandfly, and the next time it bites, it can infect a new host. These tiny insects play a huge role in disease transmission, acting as a bridge between infected and healthy individuals. Understanding transmission is crucial, but what steps can we take to prevent these diseases? Preventing malaria and Leishmaniasis involves a combination of personal protection and environmental control. Emphasize the importance of personal protection, such as using insect repellents and sleeping under insecticide-treated bed nets. These simple measures can significantly reduce the risk of being bitten by infected mosquitoes and sandflies. Equally important is controlling the breeding sites of these insects. Eliminating stagnant water and maintaining clean surroundings can go a long way in preventing the proliferation of mosquitoes. For sandflies, avoid spending time in their habitats like forest areas and rock piles. Remember, these diseases are preventable. It's all about taking the right precautions and being vigilant. Prevention is key, but what happens if you contract these diseases? Treatment for malaria and Leishmaniasis exists, but it's a race against time. For malaria, anti-malarial drugs are the first line of defense. They clear the parasite from the bloodstream, alleviating symptoms and preventing complications. Leishmaniasis, on the other hand, is treated with anti-parasitic medications. These can be oral or injectable, depending on the severity of the disease. Both require early detection for effective treatment. Delay can lead to serious health issues or even fatality. Beyond treatment, there's ongoing research for better control methods, like improved medications and vaccines. These efforts are vital in the global fight against these diseases. By understanding these diseases, we can protect ourselves and contribute to their eradication.